going to, that is fine. We're going to look at the assignment brief first, but we'll just go through it and then we will continue with the PowerPoint. Please feel free if you need to ask any questions. Is that okay, Nina? Or you want to stop me for clarification on anything? That is absolutely okay. So what can you see now? Can you see the PowerPoint? Hello, Nina.
Hello.
Yes, Nina, can you see the PowerPoint? What can you see? Okay.
Yes.
All right. So this is the PowerPoint presentation for our next unit, which is health and safety in adult care. And so looking at the image to the left, there are a number of things that relate to health and safety that we can see there. Which three of these appeal to you, Nina? Right here, in relation to health and safety. Nina, can you hear me? Hello, Nina. You may be
Yes,
muted.
I can hear you. Yes.
Okay, so which three of these things here on the image to the left appeal to you in relation to health and safety?
Okay.
Any three things that you can readily point out?
What three things? What
appeal to you in relation to health and safety?
Three things, as in, sorry, I lost you.
No problem. Which three things from the image on the left appeal to you in relation to health and safety?
Okay, the words that is written here.
Absolutely.
Okay. That could be safeguarding.
Safeguarding, great.
Abuse.
Use, excellent.
And risk.
Risk, very good. Well done. And those three are quite key to talking about health and safety, cutting across holistically, looking at the health and the safety of adult service users and residents and individuals that we take care of or look after. So these are some of the learning outcomes that we'll be considering in this unit. We have 4 learning outcomes, and I have a lot of good news for you, Nina and Lalita and Sarah, who will be joining or listening later. In this very unit, you only need to cover written work on learning outcomes 1 and 2. The rest are observable criteria. So you don't have a lot of written work to do here. And that's what students like to hear, you know. Right. So by the end of this lesson, you will be able to, I'm going to take 1, then Nina will take the next 3. Understand health and safety requirements in adult care. By the end of this lesson, we'll be able to understand health and safety requirements in adult care. Right, so Nina, would you like to take the next 3, please? You may be muted, Nina. Okay, let me take the next one. Yeah, okay then, have a go.
Yeah, which one is that?
Number 2.
understand own role, responsibilities, and accountability in relation to infection prevention and control in adult care.
Adult care. Thank you very much. Then we'll also be able to lead the implementation of health and safety requirements in adult care. And the last learning outcome that we will cover will be to be able to lead the prevention and control of infection in adult care settings, how to prevent infection and how to control infection.
Infection as in like the diseases that could be contagious.
That's right. Exactly.
Okay.
Yes. So we'll look at how to prevent the spread of infection. Right. So before we continue, I would like us to have a look at the assignment brief and some of the things that we'll be covering from there. Okay. And then we continue with an outlook of some of the things that we will need to have in mind. So this unit has a credit value of 3 and it's a level 5. These are the 4 learning outcomes we've covered, and everything that you all need to go through and comply with in completing your assignments at the end of this unit is all indicated here. Then the resources that you need are here with all relevant web links. And then we have a scenario which I want us to look at. So while we go through, we have the scenario behind our mind. And some of examples that we need to include as evidence for the portfolio include these. So this is the task scenario, the basis on which we'll be completing the assessment for this unit. As the appointed and responsible individual for health and safety in your adult care setting, you are required to prepare a health and safety handbook as a training manual for training healthcare assistants and support workers, covering the following criteria. So these are the assessment criteria that will be covered. We have assessment criteria 1.1, 1.2, 2.1, 2.2, and 2.3, then 2.4. So the learning outcomes 1 and 2 are the only ones we need to have a written task for. Learning outcomes 3 and 4 are observable criteria. And for them, you don't need to write anything, okay? So you have less written work to do in this unit. In fact, this is one of the shortest and the simplest units, and it's very interesting as well. So assessment criteria 1.1 says, summarize the legislative framework for health and safety in adult care settings. In other words, what are the laws that regulate the way we work, both the employer and the employee or the employees in adult care settings? Very simple. The second is, that's 2.1.2, describe key sources of information and guidance for health and safety in the workplace. What does that mean? Where would you find information on how to do your work in a safe way and a healthy way to protect yourself, the service users or residents or individuals, and your colleagues and other people in the work environment? Where would you get the information from? So the sources of information and guidance, that is also very simple, okay? The third one, which is 2.1, says evaluate your own role and responsibility and accountability in relation to infection prevention and control. What does that mean? What are your roles and responsibilities in the workplace for infection prevention and infection control? What do you need to do? How do you do your work? Do you need to wear gloves to do your work? Do you need to wear aprons when you're having contact with a service user? All of those things. That is what it means. Very simple, very easy, very straightforward. And you attempt it, evaluate it with relevant examples. Okay, very simple. 2.1, explain how to recognize and manage and respond to outbreak of infections in the work setting. If there is an outbreak of infection, how do you recognize it? How do you manage it? How do you respond to it? Very simple. You do that by following the agreed ways of working. Very simple, you explain that. And then 2.3, analyze how policies, workplace policies and procedures in your own workplace meet regulatory requirements and current guidance for infection prevention and infection control. That simply means analyze how your workplace policy meets the government regulation and legislation. Is it up to date? If it's not up to date, what needs to be done? You know, so a form of analysis there. And then the last question that you need to do some written work for in learning outcomes 1 and 2 is explain how to ensure an appropriate approach to the implementation of infection prevention and infection control measures in your own settings. So in other words, what procedure do you need to follow to ensure that the infection control and infection control policy is put in action, is implemented? So that's what that means. Now, there is one question under learning outcome 3 and 4 that needs to be responded to. That is 3.4, which says evaluate and improve health and safety policies and procedures and practices. So what you do is you look at your workplace health and safety policy, see whether it's up to date. If it is not up to date, what needs to be done? If it is up to date, what measures would you put in place for improvement? For example, it should be reviewed maybe every 6 months or every year. Why? Because government regulations and legislation change. And so the workplace also needs to improve in terms of update the policy to make sure it is up to date and people are complying. And the rest of the assessment criteria are observable. 3.1, interpret and apply legislation and guidance to organizational health. So these ones we want to see you perform at the workplace, and then we'll write observation report to cover that. Yes, the student has met this criteria, the student has done this, the student has been able to do this. And our observation report backs up and complements your written work. And that helps you to achieve this unit in full. Okay. Any question there, Nina?
No, Chris, so far so good.
Thank you very much. And so at on the last page here, you see here are some examples of evidence for the learner portfolio. So additional supporting evidences that we can use to support your work include analysis of data, health and safety audits, internal or external, inspection and audit reports, performance management, policy and procedural developments, including the health and safety policies we're talking about, records and reports, example of incidents and accidents at the workplace, medication-related incidents and errors, strategic planning that covers health and safety at the workplace, team meetings in relation to health and safety related things, training records, how staff were trained in health and safety and workforce development. So those are some of the things that can also be used to complement your portfolio of evidence. Okay, so I have here is a short activity I wanted us to do. Name some of the pieces of legislation. Legislation basically means the laws that protects people in a health and social care environment. Now, when we talk about health and social care environment, we are talking about care homes, we are talking about residential homes, we are talking about daycare centers, we are talking about hospitals, health and social care. Hospitals, anywhere, particularly we have adults and the elderly taken care of by the health and social care workers. It's a health and social care environment. What are some of the laws that protects people in such environments? So we're looking at some of those. The next thing we'll look at is, we're considering the different service user groups that these laws protect, the different people that these laws protects. And you see a mixture of these abbreviations here are meant to help us identify them. It's a short activity that I wanted us to do. Then the third thing is, how does the legislation impact or affect or influence health and social care services? And we'll give some examples, but we'll not do this activity now. So the next thing we want to look at is legislations that protect the individual. So these are examples of some individuals that the legislations are meant to protect. So looking at this image, Nina, can you identify who these images refer to or is pointing to? So over there,
I think these are the different sections of people. Like,
yes,
they are disabled also.
very good. People with disability definitely need to be protected.
And is there a couple from LGBT?
That's right. That's
Okay.
right.
And
excellent. Let me clap for you. You're doing well.
And the next one could be some elderly person just next to the LGBT couple.
That's right. The elderly in the community.
Yeah. And then rest are, I think they are from different ethnic groups. Could be
Yes.
religious or something.
That's right. And they could also be, to add to what you said already, there could be people who are blind, registered blind. And,
registered blind?
Yes, and need support and protection. Yes.
Okay.
So you very right there. So people with disabilities, you mentioned it, yes.
Mm-hmm.
Then we also may have children and young people, but here we're focusing mainly on adults.
Okay.
And we have the vulnerable, like some of the people you mentioned here, very vulnerable in the community. They are people who cannot, most of the time, cannot protect themselves and depend on health and social care workers to protect them, to provide their services, and also to defend them. Then we have different ethnic minorities, which you absolutely got excellently right. If I were marking, I'll give you 100%. Then we have men and women of different backgrounds, then older adults in the community who may need different protections and support. There are 5 general or generic legislations that everyone who works in the health and social care sector needs to know about. 5 general. General means they are generic, irrespective of where you work. They are generic. They work in every workplace, and everyone who works in the health and social care sector, be they doctors or nurses, psychologists, or care assistants, or nurses, or support workers, they need to know about this and comply with. They are important because of some of the things we can see here. The people we look after may be injured. They may be at risk of being abused or neglected. And then there are regulations that are meant to ensure their health and well-being and ensure workplace safety, whereby everyone is protected. So let's see, what does this one stand for? Any idea there? Which law do you think this represents?
Which law?
Yeah. The legislation.
Work Act.
Yeah, Health and Safety at Work Act.
Okay.
1974. It is
okay.
It is
Chris, can I stop you for a minute?
Yes.
Can you please give me a break for 5 minutes today in between? Because I need to log in for my son's tuition classes, and there's some technical glitch in his laptop.
Oh, sorry. Okay.
So I'll be just back in 5 minutes. We can stay online, but I'll be just back in 5 minutes.
All right. I'll pause. I'll
Thank
pause
you.
for you.
Yeah, yeah.
Thank you. Right.
Hello.
Hello, Nina.
Yeah, hi, Chris. Yeah.
That is fine.
Yeah.
Thank you. No problem. That's fine. We understand. We know you are working parents, so that's fine. Yes. So that the Health and Safety at Work Act is one of the general legislations that works across every health and social care setting. We'll be looking at that into a greater detail. Then this one, what does that suggest? Equality Act 2010. It's also one of the general legislations. We'll be looking more at that as well. And this one, the Data Protection Act and the General Data Protection Regulation, GDPR, that was recently introduced. And this one, any idea? Mental Health Act 1983, also very important because a lot of the elderly people and even some of the young people who need protection and health and social care services and to be defended need to be protected by this law, which is very important. And then this one does not relate directly with our topic, but it is also one of the general legislations, which is the Children Act. The Children Act. We're not looking at that today, but it's very important to take note of that and what it stands for. So the Health and Safety at Work Act, what is it and what does it mean? So the Health and Safety at Work Act.
You're asking me?
Yes.
Okay.
You can take us through some of the things on the screen, please.
Okay. Yeah, like as the word suggests, it sounds like what are the safety measures one should take while at the workplace.
Yes.
And it also includes the personal safety measures as well as the safety measures for the whole
measures.
Yeah, for the whole center or academy, whatever the workplace is.
Yes.
Because that's why there are very frequent fire drills are conducted, Yes. And then the internal employees are also trained how to safeguard themselves in case of any emergency. Yeah, so I think this act should be covering all these things.
Very good. Excellent. You absolutely right. And those are the things that are covered. And all the things you mentioned fall under one category, which is the employer's responsibility. And then the second category is the employee's responsibility. So most of the things you've mentioned, Nina, come under this. So protective equipment must be available free of charge. It must be available for all healthcare workers. So when we're talking about protective equipment, which is also called PPE, personal protective equipment, particularly in the healthcare setting, we're looking at gloves that must be worn before any one-to-one contact with a patient or a service user or a resident or an individual, and aprons that we must wear. And those are meant to prevent the passing on of infection either from the staff to the individual or the resident or the service user, or from the service user to the staff and other people. And as soon as we finish wearing them, we dispose of them. And these are part of the employer's responsibility to provide the equipment. Then to the right, the working environment must not put any staff at risk. So what you mentioned earlier on risk, you said what was one of the key things in health and social care. The working environment must be suitable for all people who work there, whether a staff member is physically challenged or disabled, or is blind, or is deaf, whatever it is, the working environment must be safe must not put anyone at risk, and it is the responsibility of employers to conduct risk assessments and ensure that the place is safe. Staff who use wheelchairs must have lifts that is working and functioning, so they don't have any risk if they work on any floor up. Then risk assessment was carried out. Then to the bottom right, staff must have health and safety training in every health and safety related task before they undertake it. And it's very, very important. So over here, this very point relates to both employer responsibility and employees' responsibility. It is the employer's responsibility to make sure all staff are health and safety trained. It is the employee's responsibility to ensure that they have training, health and safety training, to be able to undertake any health and safety related task. And that's very important. Okay. All right. Nina, could you take us through this, please?
What this pay secrecy clause is now illegal?
Again?
What are you asking me to read? This pay secrecy clause?
Equality Act.
Okay, so I want you want me to read all these highlighters?
Yes, please.
Okay. So it starts with the 9 protected characteristics, that is age, disability, gender, reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex, sexual orientation. All discrimination is illegal. Women have the right to breastfeed in public places. Pay secrecy clauses now illegal. Hello? Hello?
Yes, Nina. And the last one at the bottom.
Pay secrecy clauses now illegal?
Yes, so, and then women have the right.
Women have the right to breastfeed in public.
Breastfeed in public. So that comes under Equality Act. All of these come under the Equality Act. And what we saw happen this weekend has to do with the 9 protected characteristics. The pride, it comes under this. Then discrimination is illegal, so no one should be discriminated against on any basis. And all of these are important to make sure that everyone's rights are upheld and everyone is protected as both staff and service users in the health and social care environment. Then we have the Data Protection Act, which basically controls how a person's data or relevant information are used. So in a health and social care environment, as a health and social care worker, you have access to staff information, patient information or resident information or service users information. It is a private and a confidential information. We have to make sure that that information is kept under the law, the legislation. So what are some of the things it covers? Personal information must be used in a way that is appropriate. For example, not sold to medical insurance companies. It's very important that it's safeguarded. Accurate. The information must be kept accurate and up to date. All data should be destroyed. So there are times people change their contact details. There are times people change their relevant information. And when that is given, it must be updated accordingly to make sure that the information held for each service user is up to date. It should not be kept longer than it is needed for or necessary. All personal information must be kept safe and secure. It must not be left open to people who don't have any right to access it. Very, very important. It's very easy to forget about oneself in working in a very busy health and social care environment and leave service users' details open, but you will find yourself in trouble if you leave information open. Then we have the Mental Health Act. What does it relate to? So the Mental Health Act is meant to ensure that people who have mental health, who are identified to have mental health challenges or problems, are given age-appropriate treatment. For example, children should not be treated in adult wards or settings, and adults should not be treated in children's settings. There should be a maintenance of that dignity for everyone who identifies in this category. Those with treatable mental health issues can be detained against their will. Did you know that? In a psychiatrist unit for assessment or treatment against their will. That is the key thing. They can be detained against their will, and the law protects the healthcare workers to be able to do that, because at the end of the day, the interest of the individual, the service user, is what is at the heart of the service being given. And this law also gives those who are detained the right to an advocate. So if they feel unhappy and uncomfortable about whatever service they are receiving, they have right to receive advocates who would speak on their behalf. It is very important. It gives those detained a right to appeal as and when the need arises. So every health and social care worker needs to understand these laws, because the service users know their rights. But then as a staff, you also need to understand what the law means and work according to what your required responsibilities are. Okay.
So one thing is coming to my mind is like,
Yes.
Whatever acts we have read so far,
Yes.
do they have any particular definition, like what exact that act means and what area does it cover?
Yes.
And what challenges will it help us to solve? I mean, it should be like some definition, no? Because I'm quite sure once we'll get to the assignment for this,
Yes.
there must be, questions related to these act only, of course. There must be some kind of definition. Is it available anywhere? Because
Yes.
in your slides, there is no definition. It's like the generic view.
Yeah, they are available. We're going to go through all of them.
Okay, you have it in your slides?
Yes, they are. And we will look at them as we go on.
Okay. Yeah. Otherwise, I think if I take the definition of these acts from the net, then I can take it as it is, isn't it? Because I shouldn't be changing the exact definition, isn't it?
Yeah, you can use your words, but then if you use the resources, you just have to make sure you reference them accordingly. We have vast resources covering this whole unit, which you have access to.
Okay.
Yeah.
So you'll be giving that in the slide.
Yes, you get all of that. Some of them are PDF extra resources for you, and then the PowerPoints are also included. Everything is in there for you. Yeah.
Okay. So today we'll be only doing the assignment. This unit. An assignment we'll be doing for this on Wednesday.
Assignment on Wednesday. We'll cover the assignment session on Wednesday, and we'll also try to look at the referencing that we couldn't look at the other day. Yeah.
Okay. Is this long, this unit?
No, it's not long. It's not long. It's in two sessions. One part is what we're covering now, the legislative part, and the second part, the infection control part. Yeah. Right. So these are some of the employer responsibilities. One of your questions is on this. What's the employer responsibilities? This one is related to the legislations. What is the employer's responsibility in relation to the law? Okay, so these are the ones that we're going to look at now. So what must care providers, that's the employers, do to ensure legislations are carried out? Okay, so number one, the first thing employers must do is to make sure they have workplace policies according to the government legislation or the regulation or the law. it is the responsibility of every workplace to have a health and safety policy, an up-to-date health and safety policy. It must be tailored to the health and safety executive information and regulation. Very, very important. Now, so in most workplaces, it is required by law to have the health and safety executive poster at the workplace. It is very, very important. So when the health and safety officers come, one of the first things they'll look out for is the health and safety executive poster. Another thing they'll look out for is to see whether there are marked fire exit points. Very important. All these are health and safety related things. In the event of fire, in the unlikely event of fire, do people know where to go, where to pass, how to get out of the building, you know, to secure their own safety and well-being? So the first thing is policies must be in place. Now you can always link this to the employee's responsibility as well. So it's the employee's responsibility to know the health and safety policy of the workplace and comply with it. So when you take policy, you can explain it from the angle of the employer and also from the angle of the employee. It's like a double-edged sword. Okay. The second responsibility of the employer in relation to health and safety legislation is to ensure that all staff members are trained in health and safety. All staff members are given health and safety training. It's important. We need to know what to do. We need to know how to do it. So policy and procedures. Then we have redress. Service users must know how to complain if they feel unsafe, if they feel unhealthy, if they feel that the environment or the services they are receiving do not promote their health and safety. They should know how to make a complaint. So there should be complaint procedures that are clearly explained to and made known to the service users or the individuals or the residents, so they know what to do when they have a complaint. And when service users complain, the complaint must be attended to, and their needs that are expressed in the complaints must be met for them accordingly. Then there should be monitoring systems. What does that mean? Monitoring systems should make sure that the policies are being followed by staff, to ensure that the policies are always up to date when anything changes in the government legislation or regulation. To ensure also, monitoring steps to ensure that when complaints are made, the complaints are addressed adequately, and those who make the complaints are satisfied with the outcomes of the complaints. So all these procedures have to be in place, and these are some of the responsibilities of employers for health and safety. So these are some individual activities I will need you to do. You see the legislations at the bottom there. Okay, right. So let's look at the Equality Act. Nina, please, would you like to take us through the Equality Act? Thank you.
Yeah. Equality Act 2010. Which groups could this law be relevant to? All, but particularly groups which may face discrimination due to protected characteristics. Example, those with disabilities and ethnic minority groups. The Equality Act also prevents discrimination on the basis of gender and thus can protect men and women.
Good.
Three key aspects are:
Yes.
Environments such as workplaces and public buildings must make reasonable adjustments to not discriminate against people. A reasonable adjustment could be the modification to a building or working place or working practices of an organization.
Good.
It defines different types of discrimination, such as direct and indirect.
That's right. And the last bit?
How it can support individual rights. It provides legal protection to groups on the basis of protected characteristics. For example, public buildings must be made wheelchair accessible to reduce the risk that people with physical disabilities are disadvantaged or prevented from entering.
Very good. Thank you. Excellent. You read very well. So, for example, let's assume that I have a service user, maybe my mom or my dad or my uncle or auntie, in a residential home. And it's a story building. And let's assume my mom is okay, but I have a physical disability, just an example. And I am going to visit my mom. They should make sure for me to be treated equally and also to take care of my health and safety, to make sure that there is ease of accessibility to the building for me, just as you have read rightly, Nina, so that I feel I am taken care of under the Health and Safety, under the Equality Act, as well as the Health and Safety Act. And the same applies to the service users. The service users, their relatives and families that visit there, and the visitors, as well as the staff who work in the environment. So those are some of the things that the Health and Safety Act covers. So let's look at the Data Protection Act 2018. So which groups of people does this provide support for? All in recipients of services, all people in the community who receive health and social care services, but particularly those for whom their data or relevant information is very sensitive. Health related, for example, diagnosis, medical treatments. For example, if someone has cancer, it's not information that should be made open to everyone, no. Or whatever it is that means so much, very sensitive to the person, should not be made, open to everyone. Or if someone has a criminal record or offenders, all these are very sensitive information. So what is sensitive to somebody may not be sensitive to another person anyway, but there are some things that are categorized as sensitive, and they expect that their data is as much as possible protected. Okay, so the three key aspects of the data protection legislation: data held must be secure, it must be kept secure. If it is kept on the computer, the computer must be password protected, and those who have access to the password must not share it with those who don't need to know. And once you finish using your system, it is advisable that you log yourself off so that no one uses your login to access information or to send information that they are not supposed to. So information must be secure, with only authorized individuals who are able to access it. Is that okay? Number 2, data that is held on a service user must be accurate and it must be up to date. If any mistakes are identified, they must be corrected and updated as soon as possible to ensure that when information, for example, if the person's home address is wrong and communications are sent in the post, they will not reach the individual, okay? Or they may not reach the individual's next of kin, depending on what information is sent. So data held must not only be secure, it must be accurate. Then data should only be held for as long as it is necessary, not beyond the time that it is necessary for. And it should be deleted after that point of necessity. So you don't hold on to people's information more than it is necessary in the health and social care setting. And how does this support individuals' rights? Accurate data will be held by professionals, which can be used to ensure the right care and support is provided to meet the individual service users' needs or the individual resident needs. And service users have the right to confidentiality, and that has to be respected. Any question, please?
No, it's fine, please.
Thank you, Nana. So we now come to the Health and Safety Act, Health and Safety at Work Act 1974. And this act protects and is relevant to all service users, all who receive health and social care services, particularly all adult service users. And the three key aspects of this law mandates employers to have a duty to provide the correct equipment to allow all employees to do their work safely and in a healthy environment. So employees are supposed to provide every equipment that staff need. So there should be aprons, there should be gloves. During the pandemic, where visors were used, there were visors provided. Face masks were used, face masks, and in some places still provided. It is the employer's responsibility to provide this equipment that the staff are required to use. This is the law. So if someone is working in a workplace and the employer does not provide all this necessary equipment to ensure and maintain their health and safety for them to do their work effectively, that staff member can raise a complaint against the employer. It is your right. It's important that you work in a healthy and a safe environment. The reason is that if your health and safety is not protected and something happens to you, who is going to be spending time in the hospital? It may be you. They'll get somebody else to be doing the work. So it's very, very important. Then employees, number two, have a duty to follow the health and safety procedures of the organization. So there's a policy and there is a procedure. So every employer is supposed to follow the policy. It isn't just a document that is on the website or that is in the file or that is in the staff handbook. That is our policies. If they are not followed, it makes no sense. They have to be followed. They have to be applied. They have to be implemented. They have to be complied with by everybody. And management must ensure. Number three aspect of the health and safety legislation, hazards or risks that are identified in the workplace must be reported immediately. They must be reported immediately. What is a hazard? A hazard is anything that has the potential to cause harm. Anything that has the potential to cause harm or injury to anybody in the workplace is a hazard. It could be uncapped wires that are let loose. It could be a slippery floor. It could be a carpet that is torn that can serve as a trap someone can fall through. Whatever is identified as a hazard, it must be reported immediately. Risk assessment must be carried out, and the necessary amendments and adjustments must be put in place as much as possible and as soon as possible. How can the Health and Safety at Work Act support individuals' rights? The risk of injuries is reduced in services if the Health and Safety Act is put in place and it is implemented. The risk of injuries and harm and hurt are reduced. Service users have a right to be protected from harm, as well as the staff. So that's what the Health and Safety Act stands for, and that is what it does. Then we have the Mental Health Act. I'm going to request Nana to please take us through the Mental Health Act 2007. Nana, please.
Okay. This act says that which groups could this law be relevant to? Those with conditions which affect capacity and pose a risk to themselves or other people. Example, dementia or severe mental health illness. It may be particularly applicable to older adults with dementia or other vulnerable adults.
Adults, yes.
Three key aspects. People may be detained for compulsory treatment if their mental health conditions poses a risk to themselves or others.
Yes.
There are different types of section relating to how long someone can be detained for and for what purposes.
Yes.
Approved mental health professionals, example, doctors or appropriately trained social workers, are involved in arranging a section.
Good.
And how it can support individual right? This upholds individual right to be protected from harm by helping them to receive care and support during times of crisis.
Thank you very much. Excellently delivered.
What is dementia?
Dementia is a condition where an individual or a service user begins to experience a state of confusion and a state of memory loss and forgetfulness. There are different types of dementia. In extreme cases, some people even don't remember their names. They don't remember their date of birth. They can't even identify their family members. So it is one of the conditions of older people. Just as we have what is also called arthritis, dementia also reduces their ability to remember things. And there are other conditions that affect elderly people. Some of them may be vision, so some of them may lose their vision, and that's where some of them have to have, see the optician to have eye tests, and then they are given, spectacles. Some also experience hearing loss. These are some of the conditions that affect older people. But then this law, which is the Mental Health Capacity, the Mental Health Act, which is meant to assess an individual's mental capacity, is there to protect them if they cannot make decisions for themselves. They have advocacy, and whatever decision is taken in conjunction with their next of kin should be what is called best interest. The decision should always be in the best interest of the service user or the individual. And that's very, very important. That's why the law is important. The law is there to protect these people so that no one takes undue advantage of them as vulnerable adults. Is that clear now? That's a good question.
Yes.
Thank you. So, other health and safety related legislations, which are very, very important. You need to cover some of these also in the assignment. We have the Manual Handling Operations Regulation. Manual Handling Operations Regulations. Now, people who work in the health and social care sector and setting, particularly adult care, do a lot of manual handling. What is manual handling? Manual handling simply means moving and handling. It may involve the transfer of a service user from a wheelchair onto their bed, or from the bed onto the wheelchair, and also moving them, transporting them in the wheelchair from one room to the other, maybe from their room to
Wi-Fi पकड़ के छोड़ रहा है.
to the dining room or any other place that they need to go.
तो वो दूसरा नेट तो सिम से आता है तो वो पकड़ के छोड़ रहा है.
So the manual handling operation.
हाँ सिम की बात करें, मतलब सिम ठीक से रीड नहीं कर रहा है. ठीक है. हो सकता है कुछ लूज लगाओ, सिम फिर से लगा लो.
For these services.
कभी ठीक से फिट नहीं बैठता खांचे में. मेरे ख्याल से कुछ दूसरा कहा अपने घर में.
So it enables service, care workers and support workers to provide mobility support to service users to move them and transport them from one place to the other.
So the
manual handling regulations relates to. So move on to the next one. So we have this is a continuation of the manual handling operation and regulation. Please read through this. Let's go to the next one. Next one is called COSH. COSH simply means control of substances hazardous to health. Control of substances hazardous to health. 2002. Control of substances hazardous to health. In the care sector, these regulations may apply to cleaning materials and medications that may be dangerous if not used properly. And care providers must protect staff and service users from harm by ensuring that potentially dangerous substances are safely stored and that staff that use these substances are properly trained to do so. So it places responsibility on the employer to train staff in the use of substances that are hazardous to health. And it also places responsibility on the employee to ensure that they are trained to handle such substances, particularly house cleaners, cleaners, or how do you call them? The housing staff are trained to use these equipment, and it's very, very important. The cleaners use the substances accordingly. Then we have RIDDOR. RIDDOR means reporting of injuries, diseases, and dangerous occurrences regulation, 1995. So under RIDDOR, employers and self-employed and the responsible persons, people in control of work premises, have an obligation to report death or serious workplace incidents, occupational diseases. Hello, Nana. Hello, Nana.
Yes, Chris.
Hello, Nana. I think you are not muted. Yeah, thank you. Yes, so RIDDOR ensures that employers and the self-employed and responsible persons have an obligation to report death or serious, workplace incidents, occupational diseases, and specified dangerous occurrences or near misses to the health and safety executive. So HSE simply means the health and safety executive. It is the employer's responsibility, and self-employed and responsible individuals' responsibility to report these things to the health and safety executive, because all of these are recorded on and national data is taken on these things. And so it is a responsibility. Then we have what we call first aid, is health and safety, first aid regulation 1981. Employers must ensure that first aid equipment and first aid trained first aiders are present in the work environment, that employees are aware of who the first aid who the first aiders are and what the first aid arrangements are. So that if anyone has need of first aid, they know where to go to, or they know who to call on in such related cases. Okay. Also very important, because in the care homes, nursing homes, and residential homes, and in the hospitals, there is food preparation for the service users. They accept their food, they accept breakfast, they have snacks, they have lunch, they have dinner. So food is prepared for them. And there is a law that safeguards ensuring that the food preparation environment is healthy and is safe, to ensure that hygienic conditions prevail. So these are the laws that govern that. We have the Food Safety Act 1990. Then we have the Food Safety General Food Hygiene Regulation 1995. And we have the Food Safety Temperature Control Regulation 1995. So all these is a 3-in-1 legislation that governs hygienic conditions. So the Food Safety Act covers the preparation, the storage, and service of food, how food is served. And it requires the registration of food businesses, whether they are run for profit or not for profit. The food business includes canteen. So in the hospitals and sometimes in the residential homes, there are canteens and clubs, and all of these, some of them are in the care homes. So the people who provide and prepare the food must make sure they comply with the Food Safety Act. Very, very important. And the Care Quality Commission, the CQC, requires that care services ensure that the food and drink they provide is handled, stored, and prepared and delivered in a way that meets the requirements of the Food Safety Act. Hygienic conditions and the way food is stored, meat products and veggies and different things must be stored in different places. Different knives must be used for different things, and employers have responsibility to make sure that staff are trained in all of this. It's very important. After this slide, we're taking a break for 5 minutes and we'll come back to continue. And the local authority is also responsible for enforcing the law through environmental health and trading standards. And the Food Standards Agency, FSA, can intervene where appropriate local authorities fail to meet the requirements in emergency situations. Okay, so on this note, we want to put it on hold and take 5 minutes break. And then after that, we will come back to finish off. Is that okay, Naina?
Yes, Chris.
Thank you very much. Thank you. Hello, Nina. Hello, Nina. Hello, Dinah. Hello, Nina. Nina, you're back. Hello. Hello. Hello, Nina. Yeah. Okay. Thank you. Welcome back. Right. So we're going to complete this session on discussions around infection control and prevention, because assessment criteria, learning outcome 2, that is 2.1 downward, the questions are all based on infection prevention and control. How to prevent infection from spreading and how to control infection. So those are the things that we're going to look at. Now, so infection control and prevention is both the responsibility of the employer and the employee. In other words, the employer in a health and social care setting and the staff, care workers, support workers, nurses, doctors, everyone who works in the setting, everyone has responsibility for infection control. And what's the importance of infection control? It is to reduce the incidence of the spread of infection. Infection can be transferred from staff to patients in the process of caring for the patients, or from patient to staff. It can be spread from the staff in the care home or the nursing home or the residential home to the residents or the individuals, or from the individuals to the staff. So it can be either way. And that is why it's very important as a matter of legislation and workplace policy and procedure that care workers, support workers, nurses, doctors who have one-to-one contact with service users always wear personal protective equipment. For example, gloves, aprons, and face masks, as we have been used to using during the pandemic and in some places still, and face shields and goggles in some places, as much as possible to prevent and reduce the incidence of the spread of infection. Okay, and also to ensure health and safety. Now, beyond the use of personal protective equipment, for example, that the gloves, the aprons, and all of those things, the face masks, the shields, goggles, there are other infection control and infection prevention measures, which we are going to look at, and some of the reasons for that. Now, so one of the key infection control measures and infection prevention measures is what we refer to as hand hygiene. We use our hands for everything as staff in the health and social care environment. We use it to perform manual handling activities, to support, to move and handle service users and equipment. For example, you want to use the hoist, you use your hand. You want to take the wheelchair or move a service user in a wheelchair, you use your hand. You want to carry the commode, you use your hand. whatever we do, you want to make the bed of the service user, you use your hand. You want to change the service user. You want to bath and dress the service user. We are using our hands. And the same hands we may sometimes use to touch our faces, touch our eyes, touch, so it's very important that we maintain good hand hygiene. Very important. Okay. So to ensure effective hand hygiene, there are things that we do. The first one is what we call effective hand washing. So we wash our hands, and we're going to look at the appropriate way to wash our hands, because some of this will come in your assignment as well. And you can use different ways to evidence this. So we perform effective hand washing techniques to ensure that our hands are washed clearly, and also we also use the sanitizer, the hand sanitizer, the alcohol hand wraps, which has been in use massively during this pandemic. These are very important to make sure our hands, as much as possible, are free from anything that could bring contamination. Now, it's very important. I'm going to read something here. It's important to recognize that the hands of healthcare staff will always carry bacteria. See, will always carry bacteria. Why? Be it their own bacteria or bacteria that have attached as a result of activities, handling and moving equipment, touching surfaces or patients or service users or residents. Although it's not possible to sterilize our hands, the number of bacteria present can be reduced significantly, as I said, through effective hand hygiene practices. For example, hand washing or using the sanitizer or the alcohol hand wraps. So situations that can pose greatest risk include, but are not limited to this. We need to wash our hands or sanitize our hands before we come into contact with a patient or a service user or an individual. Very important. Number two, before we have contact with susceptible patient sites, such as an invasive device or a wound, maybe you need to change a patient, okay, by carrying out personal care, where you know that you are going to be touching the patient in private parts. It is very, very important. Or touching the patient's wound. It is very, very important. Number three, before undertaking an aseptic technique or procedure where you know that you are going to, come into some areas of a patient's body after exposure to bodily fluid like blood, vomit, feces, urine, and so on. It's very, very important. Before and after, we have to make sure we perform hand hygiene. This is how to control infection control measures. It's very, very important. We have to also perform hand hygiene after we remove our gloves, glove remover, after patient contact, after contact with patient's immediate environment, because the patient lives in an environment, the service user lives in an environment, the resident lives in an environment, the individual lives in an environment, in the care home, in the nursing home, at the daycare center, or wherever they are being, we are taking care of them. So before and after contact with their environment, it's very important to perform hand hygiene. Wash your hands nicely according to the technique we're going to look at shortly, and also or use the hand sanitizer. But the most effective infection control measure is hand washing, as opposed to using the sanitizer. The most effective is hand washing. Very important. Okay. So hand washing and gel application. So this is an example of the most effective technique to use in washing our hands. So palm to palm, right palm over the left and left over the right. Then palm to palm, fingers interlocked, okay? Back of fingers to opposing palms like this with finger interlocked. Then number 5, rotational rubbing of the right arm clasped in the left palm and vice versa. Then rotational rubbing backwards and forwards with clasped fingers of right hand and vice versa. It is helpful to first wet our hands before we take the how do you call it, the soap, and then after doing all of these, we wash our hands again and dry it either with a hand towel or under the dryer. These are very important. Okay, so the use of the alcohol hand wraps or the sanitizer, hand sanitizer, including alcohol and hand wraps, provide an effective and convenient alternative to hand washing with soap and water alternative, and are used in both health and social care settings to support hand hygiene. While they are effective as destroying microorganisms on socially clean hands, these are not effective in all circumstances, according to research by Peter et al. And Loveday et al. And co. That is 2014. Alcohol is not a cleaning agent. Alcohol-based hand wraps should not be used for hand hygiene when hands are visibly dirty. Okay, so what is the alternative? That is hand washing, like I said earlier on. Okay, so supporting hand hygiene. To support compliance with hand hygiene, this is law, okay? In the workplace, healthcare workers should meet the following standards while working. Keep nails short is the expectation. Clean and polish free. Avoid wearing wrist watches and jewelry in the health and social care environment. Avoid, why? Because they can carry things, you know. Avoid wearing rings and ridges or stones. A plain wedding band is usually acceptable, but you have to refer to your workplace policy. Do not, well, there are other things there that you have to look at your workplace policy. It's very, very important. Short sleeves are prescribed, and there are various reasons for that because of violence in relation to some service users in the past, which research has proved. So you see that a lot of the uniforms in the workplaces are short sleeves. It's very important. You also need to report skin conditions affecting your hand. For example, anything that you know can be contagious to occupational health provider for relevant advice. Then we have the hand hygiene facilities. We have skin, hand towels, soap, alcohol, hand gel, and dispensers. And these have to be used where provided. Then hand drying, and conditioning. Wet hands transfer microorganisms more effectively than dry hands. Okay, so multi-drug resistant gram negative bacteria favor wet and damp environments. So effective hand drying is an important method in preventing the spread of infection. And when you are writing your assignment, it's relevant to input these very important information. Inadequately dried hands can also be prone to developing skin damage. Disposable paper hand towels should be used to ensure hands are dried thoroughly. Fabric towels are not suitable for use in healthcare facilities as these quickly become contaminated. Of course, absolutely, with microorganisms, which can then, recontaminate hands after washing the hands. And so all of these have to be taken into consideration as much as possible. Is there any question before we continue? We're going to talk about using personal protective equipment, that is PPE. So PPE includes items such as gloves that I've talked about earlier on, aprons, face masks, goggles, and visors. Visors, some people call them shields, face shields. These are some examples of PPE that are used in the healthcare environment, health and social care environment. Staff who work in the kitchen also use nets to hold their hair to make sure things don't, drop. PPE is used to protect healthcare workers from harm. In this case, from risk of infection. PPE such as gloves may also be required to contact with hazardous chemicals and some pharmaceuticals, for example, disinfectants and cytotoxic drugs. Now, let's look at the disposable gloves. The gloves are not a substitute for hand hygiene. Even when you use gloves, after using the gloves, you need to either wash your hands or use the hand sanitizer. It's very important to keep you safe and to keep your colleagues and also the service users very safe. Overuse of gloves is an increasing concern. So wearing gloves only when required is important, as the incorrect use of gloves can lead to several problems, including undermining local hand hygiene initiative and skin problems. So it has to be used according to the policy of the workplace. And that's very important. So these are some of the measures for hand hygiene, and it relates to workplace depending on what the policy is. So let's look at gloves in a little detail. Gloves, the glove good practice points that gloves are not an alternative to hand hygiene. Like I said, gloves should only be worn if a risk assessment is identified as a need. The gloves are not required for routine bed making or feeding patients. There are different types of gloves. Some people have reaction to some gloves. And so depending on the one that is suitable and you are comfortable with, that is the one that you should go for. Okay, so we have gloves there. Let's look at the disposable plastic aprons. Disposable plastic aprons provide a physical barrier between your clothing and your skin, and they prevent contamination and wetting of your clothing or your uniform when you are bathing or a service user or washing them or when you are cleaning equipment. So it protects you, it protects your skin, protects your body, and also protects the service user or the individual or the resident being taken care of. Aprons should be worn whenever there is a risk of contamination of uniforms or your clothing with blood or bodily fluid from the service user, and which can bring about infection. These are very important. So just as gloves, aprons should be changed as soon as it is intended. So once you have a contact with one service user with your gloves and apron on, you should dispose of your gloves and your apron and wash your hands or sanitize your hands before you go to the next service user or individual. So you don't carry anything from one service user to another service user with the same gloves and the same apron. No, it has to be changed. So it also helps protect yourself. It's very important. That's good practice. Always change your aprons, change your gloves after contacting one service user before you go to the next service user. Now, during the pandemic, in the hospital that I work with, when you go to intensive care, we don't use just aprons. We use gowns, protective gowns, the blue gowns, and then at a point they brought the white ones. It covered everybody. They were long sleeves. It covered every part of our body. And when we have your mask on, and then we also have the face shield or the goggles on to make sure we are adequately, covered to protect both ourselves and the service user. And these are very important. So gowns, impervious, that's waterproof gowns, should be used when there is a risk of intensive contamination of blood or body fluids, or when local policy in your workplace dictates that these should be used in the settings. It is very important. So then the masks or devices are for eye protection, and these should be worn when a procedure is likely to result in blood or body fluids or substance splashing into your eye. There was one particular person who told me that during the COVID, we were working in the hospital, and part of the effect that she had on her body in relation to the COVID the pandemic was that she had eye infection. And you can see it very, very visibly that her eyes were affected. And that is why the use of the goggles or the face shields were very, very important. And these things are there to protect us and our families. So you don't carry anything from work to the house where there are innocent children, and sometimes people come home from work and then their children just come and hug you. So these things are there to protect us as well. Then we have the masks. They may be necessary if suspected or confirmed infection may be spread by an airborne route. For example, multi-drug resistance, tuberculosis, or other high-risk infections transmitted through respiratory routes. So that is through our mouth or through our nose where we breathe. And that is why we were using the mask to cover both our mouth and our nose, because these are the facial respiratory routes. Okay, these have been used widely, and so we all know the importance of this. Then the visors or the goggles. I have my goggle there, one there. So it can be utilized to protect the eye membrane. Some visors can offer full face protection. There are some that are, so wide, covers the whole face. The choice of visors or goggles will depend on the task that you are assigned or the procedure to be undertaken. But a risk assessment is always likely to be done before all of that. And the policy of your workplace will always be updated to cover what should be done and what should not be done. That's why it's always important to ensure that you follow the workplace policy and procedures accordingly. Right. So what are the consequences of not complying with the health and safety regulation, particularly in relation to infection control? Healthcare organizations can be subject to criminal law enforcement action if they fail to comply with the requirements of the law in relation to infection control measures. So there are consequences that will apply. Then let's talk about safe handling and disposal of waste. This comes under COSH, Control of Hazardous Substances that can affect health. Any healthcare worker, take note please, healthcare worker or support worker that produces waste as part of their job. In the healthcare environment, there are different waste disposal measures that we follow. there are some beans, there are some bags, some are yellow, some are red, some are white, different things and what goes into them, depending on what the policy of any workplace is. It's very important to make sure we comply with the waste disposal policy and procedure at the workplace. It's very, very important. Whoever does not comply can be held accountable. These are regulated things. Very, very important. So when it comes to infection control, these are some of the things that we consider, and they relate to what the employer's responsibility is and what the employee's responsibility is. There are some things that will not be relevant for us, but if you are going to study widely and broadly, especially if you want to be working in the health setting and not only the social care setting, they are important for you. Okay. Right. So you can look at these more in detail. All these are made available to you. Mansi is going to kindly send these to you. These are extra resources for you. You can use this in your assignment. Just make sure you reference them appropriately. Okay, so is there any question before we bring this session to an end?
No, Chris, fine. Are we done for today?
Yes, we are, unless there is a question, because we have 10 minutes.
Okay, because my phone is about to die. Oh, okay. And coincidentally, my husband has took the charger with him.
Oh, okay, that's fine.
So my phone could be off anytime. So I don't want to vanish abruptly. So I just thought to, I just thought to inform you, like, because my phone could die any moment.
Thank you. Thank you so much for letting me know.
Yeah. So I think these resources will be sent to us by tomorrow.
Yeah, I'm going to send them to Mansi after this session, considering that it's late there. And so she would confidently send them to you by tomorrow.
Okay. And for the previous assignments, I'll request you to, like, within the coming 10 days maximum, I'll be submitting the first 2 modules. And then after that, this third module.
This new one. Okay.
Yeah.
So like I said, thank you very much. Well done for your hard work. And thank you for engaging with today's session, considering that the rest of our class are not available at the moment. I really appreciate you for.
And the assignment for this unit we'll be discussing on Wednesday, right?
We'll discuss the assignment on Wednesday, and it's quite straightforward and simple.
Okay.
I know you can do it within one day.
Yeah. It's quite interesting also, you know.
Yes, thank you so much. Yeah. Thank you, Nina. I really appreciate
thank you, Chris, for today's session. It was very engaging and good.
Thank you.